So lymphoma often presents as an abnormal lump in a lymph gland. This is often in the neck or in the groin or under the arms where your lymph glands are. Sometimes patients with lymphoma can have other symptoms such as itching, sweats, weight loss or loss of appetite. But many patients with lymphoma can present without any symptoms whatsoever. Those without symptoms are classified as having A disease, and those with symptoms, which involve the sweats, itching and weight loss, have what's called B disease. And both Hodgkin's and non-Hodgkin's patients can have similar symptoms.
Leukemia is a neoplastic disorder of the bone marrow. Cells proliferate without control. There is no differentiation in the cells, and eventually patients can develop various symptoms and signs related to the bone marrow failure. Without having normal red cells, the patients can become anemic. Without having normal white cells, the patients are very susceptible to infections. And finally, without platelets, patients can easily bleed.
Myeloma is a form of blood cancer. It is rare in that it only really affects 3 to 4 in 100,000 of the population, and the symptoms can be relatively non-specific, which makes it difficult for GPs often to diagnose this condition. The symptoms can be things like tiredness, there can be things like pain, usually in the bones, most commonly the back, but also a history of recurrent infections, which would be unusual for that individual patient. If you do have symptoms that persist for more than a few weeks in terms of bone pain, recurrent infections or reduced energy levels, then it's always worth going to see your GP just for a simple blood test. This simple blood test can pick up a disease such as myeloma in the vast majority of patients.